Steve, to some degree, there's a lot of hypocrisy about this. And it really is not focusing on, in fact, the serious problem of deficit reduction. We do have to deal with that. A lot of it is ideological. A lot of what we're seeing right now in the Republican bill that I will vote against today is what they've always wanted to do. Cut back on the needs of working people, give tax breaks for the wealthiest people in this country, allow the loopholes. We are losing $100 billion a year because of corporations and the wealthy stashing their money in the Cayman Islands and in Bermuda. Tax havens. Outrageous. You think my Republican friends who are concerned about the deficit are going to go after that? They're not. So a lot of this thing is not just moving toward a balanced budget. A lot of it is ideological. It is forget the needs of the middle class and working families. Let's worry about the rich and the powerful.
One other set of numbers, and then we'll talk about your book and get to our viewer calls and comments. Looking at the discretionary spending and mandatory spending of the federal budget. You've seen the figures, but it's about 36 or 37% that is discretionary. The mandatory programs that you talked about, Social Security, Medicare, Medicaid, accounts to about 57% of the budget, and interest on the debt accounts to 6% and growing. So as you look at those numbers, where do you cut? Even if you increase taxes, where else do you cut?
Well, there are a lot of ways that you can cut. Now, for example, healthcare. Everybody agrees. Whether you're conservative or progressive, everybody agrees. The cost of health care is outrageously high. But let's ask ourselves a couple of questions. Today in America, we have 50 million people who have no health insurance. We have about 45,000 people who are going to die this year because they don't have access to a doctor. That's the fact. And yet, at the end of all of that, health care costs in America today are almost double that of any other major country on earth. You know, that's almost double. Why is that? Why is that? Now, one way you could solve that problem is to do what some governors are now doing. Let's throw low and moderate income people off of Medicaid. Well, that's fine. Just throw them off. Well, if you're 50 years of age and you develop a lump in your breast and you don't have any health insurance, what do? Well, you could die. I guess that's one option. Or you go to the emergency room and they send you to the hospital. Who's going to pick up that bill? Well, you are. People with insurance are going to pick up that bill. That's one way to go. The cost of health care is soaring. We've got 15 million people without any health insurance. Now, I think the health care reform bill that was passed last year takes us some way in the right direction, but it's nowhere near enough. Why do we spend twice as much per person on health care as any other nation, and yet our outcomes are, in many cases, not as good as some of the European countries or even Canada? And the answer is that we have private insurance companies in the midst of all that whose function in life is not to provide quality, cost-effective health care to the